Assessment. You will be given 5 minutes before entering this station to read through a patient information booklet. Use this time to plan out your assessment. Try to make the assessment conversational and respond to your patient appropriately. You may be asked to complete a NEWS, a Neuro GCS or a community-based assessment. Your patient will be an actual person and not a mannequin for this station. You must document all your vital signs on the chart provided and verbalise the NEWS score or the GCS score before you leave this station. Keep a close eye on the time and try to bring your assessment to a natural finish rather than abruptly finishing as you run out of time. So enter the room, checking it's safe to do so, cleaning my hands with some alcohol gel. Good morning.
Good morning.
My name's Julie, I'm one of the nurses here.
Okay.
Can I just double check your name, please?
Yeah, my name is Sarah Hudson.
Sarah, and what would you like to be called?
You can call me Sarah.
Okay, Sarah. Could you tell me your date of birth, please?
Yeah, my date of birth is 12th of April 1990.
Okay. Can I just double check that with your wristband?
Yes, you can.
Oh, mind your drink. Okay, Sarah Hudson, 12th of the 4th, 1990.
Yes.
Hospital number is F12345H.
Yeah.
Lovely. I see you've got a white wristband, Sarah.
Yeah.
Does that mean you don't have any allergies
No,
at all?
I don't have.
Okay, that's lovely. So, Sarah, I've come here this morning to undertake an assessment on you,
Okay.
get some observations done, including your blood pressure, your pulse, your respirations, things like that. Is that okay?
Yeah, okay.
Do you have any pain at the moment?
Yeah, a little bit.
A little bit. If I was to ask you to score your pain from 0 being the no pain at all and 10 being the worst pain imaginable,
Okay, I have scored 6.
6, so that's quite a lot. Have you had anything? Did they give you anything in A&E?
I don't remember that.
Okay, so are you okay to ask just a few questions and get these done?
I'm okay.
And then I'll go and double check and see if we can get you some painkillers. Will that be okay?
Yes.
Okay. So it's going to take about 10-15 minutes. Do you need to use a washroom or anything like that before I go?
No.
Okay, lovely. So I'm just going to move this table slightly so I can bring the equipment in. Is that okay? You can keep your drink, that's fine.
Okay.
So I can confirm that this equipment has been cleaned and calibrated this morning, so it's safe and ready to use. So, Sarah, have you had your blood pressure taken before?
Yes.
Yeah, and a similar machine to this?
Yeah.
Okay, so can I ask you to roll
Sure.
your sleeve up?
Is that okay?
Yep, that'd be fine. Now, can I just double check you haven't had any surgery on this arm?
No.
No surgery to your breast or anything like that? Okay. And I'm checking your arm. There's no cannulas in this arm, so it'd be okay to use. Okay, so I'm checking that we have the right size cuff.
Okay.
It needs to cover at least 80% of your arm,
Okay.
and it needs to be 2 to 3 centimetres above your antecubical fossa. Get that through there. Okay, so we need to have this lined up. Okay, that's going to come round. It's not too tight, no?
No.
Okay, so Sarah, can I just double check that you haven't got your feet crossed?
No.
No,
it's not
and you're
crossed.
nice and relaxed. Keep your arm still. Now, when I turn this on, it's going to get tight. It's be a bit of pressure, okay?
Oh, I know.
Nothing to worry about. That's quite normal,
Yeah.
okay? Okay, so there we go. So can I have a look at this hand? So checking for your pulse oximetry. I'm checking that your fingers are warm, they're not cold and clammy, and that you don't have any nail varnish or false nails on, and your capillary refill is less than 2, so that's lovely. I'm going to pop that on there if I may. Just relax. Okay, whilst that's doing that, I'm just going to write your name on this chart. Is that okay?
Yes.
Sarah Hudson. Date of admission today. Date of birth was the 12th of the 4th, 1990.
Yes.
Lovely. Okay, so your blood pressure is 98/67. And your pulse oximetry is 90. I'm going to relieve you of all that.
Is that okay, 98?
That's good. That's good.
Thank you.
Put a dot on there. Today, and the time now is 10:40. So let's free you up from all of this. Okay.
Okay.
When I leave, I'll make sure I take this equipment with me and clean it ready for the next use. So next I need to do your temperature. So this is a tympanic temperature. It goes in your ear. Do you have any hearing aids at all?
Actually, I don't know.
No? Have you had any problems with ear infections or anything like that?
No.
Lovely. So I'm going to pop this in your ear, okay, and you'll hear it make a strange beep.
Okay.
Wonderful. Lovely. And I will dispose of this in the clinical waste. Temperature is 37.1. Okay, so now I'd like to record your manual pulse, if that's okay.
Yeah.
So I'm going to do this for 2 minutes, so just if I can ask you just to be quiet whilst I do that, because I can't count and talk at the same time. Okay, so starting now. Okay, Sarah, thank you for your patience there. That feels like the longest 2 minutes in the world, doesn't it? So I counted both your pulse and your respirations in that time, okay? So I'm just going to chart those. Your respirations was 16 and your pulse was a 78. Okay, so you're alert, you're nice talking to me, and you're not on any oxygen. So Sarah, we use this chart called the National Early Warning Score. It's a system that allows us to assess the condition of our patients, okay? So I'm just going to add up your score here. So you're coming out with a score of 2. That's because your blood pressure is a little bit on the low side. It's within normal range, but it's on the lower side of normal, okay?
Is that okay?
Yeah, that's fine, that's fine. It's probably because of have you been a bit dehydrated at all, or the infection at all, maybe? We'll keep an eye on it anyway. So because of your score, we're going to monitor you every 4 to 6 hours and come back and do your blood pressure and everything again. Okay, we don't need to escalate your care at this time, but are you happy with that?
Yes, I'm happy.
Okay, so Sarah, I see from your notes that you've got a dog bite.
Yeah.
Yeah?
It's anapolis, obviously,
Yeah.
I'm trying to catch the thief from this dog, and that's right.
Oh, nasty. Nasty. And so that was 4 days ago and it's been getting worse, yeah? Okay. We're going to start you on some antibiotics.
But actually I'm taking the antibiotics.
Okay. Okay, so we'll get to that. We'll speak to the doctors about that, okay? So, is there anything you need to tell me that we can look after you the best way possible that we need to know, do you think?
See, I have pain, so do something for me.
Yeah, okay, we'll sort that out.
Okay. Give me some medicines or injections, because it's painful.
Okay, I can do that. Is it preventing you from walking at the moment? Is it painful to walk, or?
Yeah.
You sort of have to limp, but can you still manage just about get to A from B? Okay. I take it as a police officer, you're normally quite fit and healthy and don't have any problems normally. What about eating and drinking? No problems?
Yeah, it's normal.
Yeah, lovely. So have you been spiking temperatures at all since you've had the infection? Have you been aware of having any flushes or anything like that? Okay. So I'm not going to complete a full assessment at this time because I know you're in pain. So I'm going to go and get you some painkillers and help you settle. I've got enough information here with your observations and things to be able to start your care plan. But when you are settled, I'll come back and we'll do a complete nursing assessment. Is that okay?
Okay.
Okay, so I'm going to take all this equipment away, Sarah. Okay. And I'm going to go and find your drug chart and speak to the doctors and get you some painkillers. Okay?
Fine.
Okay, so I'm taking the equipment with me to clean it and I'm making sure my patient has a call bell in case she needs to contact us. So Sarah, I'm going to leave you with the call bell. Okay. If you need anything at all, just push this orange button. Okay. Myself or one of the other nurses will come into your assistance, okay? So I'm going to take the equipment and clean it and speak to the doctor and I'll be back with some painkillers for you, okay?